If you're someone who's been suffering with a chronic, serious whiplash from a car accident, or someone who just wants to know what to do should you be involved in a car accident in the first place, here are the 5 things that you are never told after a car accident. Whether you're in serious pain, whether you suffer whiplash, whether you walk away and you feel fine, you need to know about all of these things. In fact, in this video, we're going to go over those 5 things that you're never told after a car accident. I want you to remember the number 8.2 and how that applies. Please stay to the end for a bonus that everyone should know to lessen the injury before a car accident ever happens. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I have been helping people for almost 35 years now. My YouTube channel focuses on those suffering with either chronic neck pain or chronic low back pain and ways to deal with this from a non-surgical point of view. Please, before we go any further, smash that subscribe button if you want to learn more tips and strategies on how to help people suffering from that chronic back and neck pain. So what is the number one thing you need to know that you're not told after a car accident? Well, first of all, let's understand what's actually happening in a car accident. The most common injury is a whiplash injury. So whiplash, you've got the vertebrae, the red is the disc, then you've got the vertebrae below. So whiplash is really what we call a hyperflexion, hyperextension type of injury. So what that means is hyperflexion is the vertebrae go forward more than they should, quite significantly and often quite violently. And then that's the hyperflexion point. And then they go backwards far more quicker and more significantly, causing more damage than they should as well. That's what a whiplash injury is. It's a hyperflexion, hyperextension. Where does 8.2 come from? 8.2, there's a fantastic study out of Cambridge University that shows you only need to be going 8.2 miles per hour to cause significant damage in a whiplash type injury from a car accident. People are never told this. What happens is people focus on the symptoms instead of the damage that's actually been caused. That's huge to know the difference. So that doesn't mean that anytime you're in the most mild of fender benders, that you're suddenly going to need all this care. But what it does mean is you probably did more damage than you realize, and that's why you need to get checked out by a professional who understands all this. You don't need to be 8.2 miles per hour is not very quick. And so what happens is sometimes you'll feel that injury immediately. Sometimes you may not feel it till the next day. The problem is sometimes you may not feel it till a month later. And when that happens a month later, do you say, oh, that must have been from the car accident? No, you say, you know what, I have been working at the office a lot more lately, or maybe, it was that hockey hit I took, or maybe it's just the stress that I feel tense and so forth. It's important that you get checked out by a professional who understands these type of whiplash injuries to help prevent further damage. Don't focus on the symptoms. Always look at what damage has actually been caused. The second thing you're never told after a car accident, especially with a whiplash, is going to cause damage to the spine. What I want you to, hopefully you're not going to be in a car accident, but should you be, look at the damage that actually happened to the car. If that accident can cause that much damage to metal, what do you think it did to your spine? So the problem is when you damage the spine like that, it's also going to wear and tear faster. So what they never tell you is if you've been involved in a car accident and any type of whiplash injury especially, that spine, especially the neck, is going to degenerate 10 years quicker than it otherwise would. So if you're the average 30-year-old, after a car accident, you're going to have the neck of a 40-year-old. That's important to know, and that's important to help not only treat, otherwise, it's going to create all sorts of problems down the road. Going to affect those vertebrae, you're going to affect the disc, you're going to affect the ligaments, you're going to affect the muscle, but you will speed up degeneration in the spine by 10 years. The third thing that you're never told after a car accident is that almost always in any whiplash type of injury, you're going to lose the normal curve in the spine. This is important because your neck should have what we call a C curve to it. The reason it has that C curve is that's what gives it proper structure, proper support. I don't know if you know a lot about engineering, but that's why bridges have arches to them. Almost always following any type of whiplash injury, you actually lose that curve in the spine and that curve actually straightens out. Unfortunately, often that's going to be misdiagnosed by a number of doctors who will just say, oh, well, that's just muscle spasm and that will go away. No, you lose that curve and you often lose that curve permanently. And the reason that's important is once you lose that curve, what you're now going to do is it then changes how you carry pressure over those discs. And when you change how you put pressure over the disc, now you notice how we're putting a lot more pressure on the front part of the disc. Well, that's going to lead to disc herniations down the road. Think of a disc herniation like a jelly donut. If I squish the front, it's going to come out the back. Does your insurance company ever tell you this? No, because they look at chasing pain and they think once the pain is better, then you must be cured. This is something, again, number 3 on the list of things you need to know after a car accident. The 4th thing on our list of 5 things you're never told after a car accident is your insurance company is not your friend. I know it's a nice thought. I know the commercials are nice and fluffy. When you're in trouble, we're here. I don't want to use the particular brand name of that jingle. They're not your friends. They are a business, and their business is the more money they bring in and the less money they pay out, the better for their business. Now, that doesn't mean all insurance companies are necessarily evil, but they are looking to give you the minimal amount of care to actually make you feel better, make you think that your pain is cured and so forth. And we've already shown you that you don't want to chase symptoms. That's not the way to do this. So what you need to know is, I'm in the province of Ontario, so that's the largest province in Canada. If you're in Ontario, under motor vehicle legislation as it sits right now, is they are responsible for getting you back to your pre-accident state. So, and that's a functional state. So what that means is, again, you're not chasing pain. If you've been in pain all your life and then you get in the car accident, they're not responsible for magically getting rid of all the pain that was there prior. But by the same token, if you were someone filled with osteoarthritis and had no pain, and then you got in a car accident and suddenly you have all this pain, they are not allowed to say, oh, well, that was your pre-existing osteoarthritis. If you were pain-free before, if you were able to do certain things, if you had what we call your activities of daily living, and those are now restricted, they are responsible for getting you back to how you were the way before. That becomes especially important because often insurance companies will send you off for independent exams. And the problem with a lot of independent exams is often the doctor or whoever sees you is someone who focuses more, supposed to happen in theory, and doesn't necessarily have a lot of clinical experience. Or they make the assumption that everyone is going to be the same. Not everyone with a grade 1 or a grade 2 or a grade 3 whiplash is going to heal at the same rate. Or they are people who err on the side of minimizing your care, again, either chasing the symptoms and not giving any credence to what the damage that's actually been done in there. These are all important things. So again, if your insurance company says, oh, yeah, sorry, that was pre-existing, it may have been pre-existing, but if the accident made it worse, they're responsible for getting you back to how you were. Make sure you find a good health professional who's on your side. And on your side doesn't mean they will never do anything to falsify or anything fake, but they will make sure you get back to the optimal state, to your pre-accident state that you should be. Make sure you find someone who has your best interest at heart. Number 5 on the list of things that you're never told after a car accident, we've touched on number 4 a little bit as well, is understand that if you had a pre-existing condition, but that condition was made worse, and it doesn't have to be just whiplash and neck pain, that could be back pain, that could be a shoulder injury, that could be a knee injury, and you say, well, how does my knee get affected? If you're jamming on the brakes, if those knees jammed against the dashboard, whatever the case may be, it is very possible that the accident exacerbated or made your condition worse. The insurance company is responsible for getting you back to how you were prior to that. In the health world and the medical world, we have something called MMI, which stands for maximum medical improvement. I don't want to get too technical here, but maximum medical improvement is something they list you at when they believe you've gotten as best as you're ever going to get. And unfortunately, we shouldn't be looking at that. Because first of all, often that determination is made by someone who is limited in actually improving your MMI. In our clinic, we have many people who were believed to have reached their MMI, and we now have them much, much better than they were, prior to that, based on functional objective testing and their activities of daily living. But instead of MMI, they need to consider something called MMD. So that's maximum medical degeneration. Put that with everything we've said, the other 4 things that you've never told after a car accident. So if we know the car accident is speeding up your degeneration by 10 years, if all they've done is ease your pain, well, where are you going to be 5 years down the road, 10 years down the road, 20 years down the road, if this accident has in fact already sped up your degeneration by another 10 years? So we need to look at the long term, what any type of accident has done to you. And again, hard for you to judge. Go to someone who understands these injuries well, and someone that you can trust, so that you can not only get the care that you deserve. And this last segment that we're about to go over in the next 60 seconds, please share this with everyone you know, especially if you have teenage kids who are driving. One of the best things you can do to help prevent damage from a whiplash in the first place, or to lessen the injuries, is to make sure that your headrest is properly positioned. What you want with the headrest is you want the back of your head, should there be a car accident, you want it to hit the bulk of that headrest. If that headrest is too low, what's going to happen is your neck is going to use it as a fulcrum, and your head is going to ramp over that, what we call ramping over that. That's going to make that extension part of the whiplash that much worse. We don't want that. The second thing that you want to do is when you're driving, have your seat positioned such that your head really is only 1 to 2 inches beyond the headrest itself. If you're one of these people who drives up like this, and then were to get the force of that whiplash coming back, then you're just adding that much excessive force. It's almost like you're giving yourself a concussion to the back of the head. For this headrest to work the way it was intended, is you really should be positioned such that your head is literally an inch or two off, and possibly even lying on the headrest itself. That's going to stop a lot of that force, and certainly also going to help to prevent that ramping effect as well. Please go take 2 minutes today and make sure the headrest is properly positioned, and put yourself in a position that you're the correct distance away from the headrest. Now, if you found value in this video, please like and share it. Please smash that subscribe button if you want to hear more tips and strategies on how to help people with chronic neck pain and chronic low back pain. If there are others that you think could benefit from this, please share it with them as well. The next video you should go watch is this particular one on how to deal with neck pain and disc herniations.